Hello friends, Dr. Alan Mandell here, and today I want to talk with you about something every older adult and caregiver needs to hear. We live in a world where medications are everywhere. Pills for pain, pills for sleep, pills for blood pressure, pills for cholesterol, and sometimes we don't stop to ask the real question, are these pills helping us or hurting us? As a cardiologist, I spent decades treating patients with heart disease, stroke, high blood pressure, and artery problems, and I noticed something alarming. Many seniors, especially those over 60, are taking medications that actually increase their risk of heart attack and stroke. Now listen closely, because this isn't fear-mongering. It's science, it's clinical evidence, and it's happening right now. Today I want to walk you through 4 or 5 common pills that may raise cardiovascular risk in the elderly. When we talk about heart attacks and strokes in the elderly, most people immediately think about cholesterol, high blood pressure, clogged arteries, or family history. But what many don't realize, and this is extremely important, is that some of the very pills sitting in your medicine cabinet may quietly increase that risk. I'm not here to create fear. I'm here to create awareness, because awareness gives you power. Let's start with something incredibly common, over-the-counter pain relievers. Medications like ibuprofen and naproxen are taken by millions of seniors every single day for arthritis, back pain, knee pain, shoulder pain, you name it. They reduce inflammation and provide relief. And when you're in pain, that relief feels like a blessing. But here's what most people are never told. These drugs can increase blood pressure, strain the kidneys, and cause changes in the lining of the blood vessels. When blood pressure rises even slightly but consistently, it places additional force against the arterial walls. Over time, that pressure can destabilize plaque inside the arteries. And when plaque ruptures, that's when you get a clot. A clot in the heart leads to a heart attack. A clot in the brain leads to a stroke. In older adults whose arteries are already more fragile, this risk becomes even more significant. Now, I'm not saying that one pill will cause a heart attack. What I'm saying is that chronic use, especially daily use, can increase cardiovascular risk in people who already have high blood pressure, kidney problems, or underlying heart disease. And the danger multiplies when these medications are combined with other prescriptions. Next, let's talk about certain sleep medications. Many older adults struggle with insomnia. They can't fall asleep. They wake up at 3 a.m. and can't go back to sleep, so they're prescribed sedative medications, including benzodiazepines or so-called Z drugs. These medications may help initiate sleep, but they also affect the nervous system and can suppress normal cardiovascular regulation. In the elderly, these drugs can lead to drops in blood pressure, irregular heart rhythms, confusion, and increased fall risk. But here's the deeper issue: disrupted autonomic balance. Your autonomic nervous system controls heart rate, blood pressure, and vascular tone. When sedatives interfere with this delicate system, the heart may not respond properly to stress, dehydration, or sudden changes in position. This can increase strain on the cardiovascular system and in some cases contribute to stroke risk. Now let's move to certain older diabetes medications, particularly some sulfonylureas. Managing blood sugar is essential, absolutely critical, because uncontrolled diabetes is a major risk factor for heart disease. But some older medications can cause episodes of low blood sugar known as hypoglycemia. In younger individuals, mild hypoglycemia might cause shakiness or sweating. But in older adults, it can trigger a surge of stress hormones like adrenaline. That adrenaline spike increases heart rate and blood pressure suddenly. For someone with coronary artery disease, this surge can reduce oxygen supply to the heart muscle. That imbalance, increased demand and reduced supply, is a setup for cardiac events. Repeated episodes of hypoglycemia can also increase inflammation and destabilize existing plaque in the arteries. It's not just about blood sugar numbers, it's about how the body responds to sudden changes. Then there's hormone therapy. Hormones are powerful. Estrogen and testosterone affect not just mood and bone health, but also blood clotting and vascular function. In certain individuals, particularly when started later in life or used without proper monitoring, hormone therapy can increase clotting tendency. When blood becomes more prone to clotting, the risk of blockage in the arteries rises. Clots don't give warnings, they form suddenly, and in older adults whose circulation may already be compromised, even a small clot can have devastating consequences. Finally, let's discuss long-term proton pump inhibitors, medications commonly prescribed for acid reflux. These drugs reduce stomach acid and provide tremendous relief for chronic heartburn. But prolonged use has been associated in some studies with changes in magnesium levels, endothelial function, and vascular health. The endothelium, the inner lining of your blood vessels, is incredibly important. It regulates dilation, constriction, and blood flow. When that lining becomes dysfunctional, arteries lose their flexibility. Stiff arteries contribute to higher blood pressure and impaired circulation. Over time, this environment increases cardiovascular strain. What's crucial to understand is that none of these medications are inherently evil. They serve real purposes. They relieve pain, control blood sugar, improve sleep, manage hormones, and treat reflux. The issue isn't that they exist. The issue is that aging changes physiology. As we age, kidney filtration declines, liver metabolism slows, blood vessels stiffen, the heart becomes less tolerant of stress, drug clearance decreases. What your body handled easily at 50 may overwhelm your system at 75. Add in polypharmacy, taking 5, 6, 7, even 10 medications, and the picture becomes more complex. Drug interactions amplify side effects. One medication raises blood pressure slightly, another increases clotting tendency, another alters kidney function. Individually, the risk may seem small. Together, they create a cascade. And here's the silent part. You may not feel it happening. There's no alarm bell when arteries become inflamed, no flashing light when plaque becomes unstable. The first symptom may be chest pain or weakness on one side of the body or difficulty speaking. That's why proactive awareness matters so much. If you are over 60, especially over 70, it's essential to periodically review every medication you're taking, including over-the-counter drugs and supplements. Ask, is this still necessary? Is the dosage appropriate for my age? Are there safer alternatives? Are there lifestyle changes that could reduce my need for this medication? Pain may respond to physical therapy, anti-inflammatory nutrition, or targeted exercise. Insomnia may improve with sleep hygiene and stress reduction. Blood sugar often improves dramatically with dietary changes and weight management. Reflux can respond to meal timing and food choices. Medications can be life-saving, but they must be individualized, especially in the elderly. Your heart is resilient, but it is not invincible. Protecting it means looking beyond cholesterol numbers and blood pressure readings. It means examining every factor that influences vascular health, including the pills you take every day without a second thought. Knowledge is protection, and when you understand how certain medications may increase cardiovascular risk in older adults, you empower yourself to make informed, intelligent decisions, not out of fear, but out of wisdom. One of the most important truths we must understand as we grow older is this: the body you have at 70 is not the same body you had at 40 or even 55. And yet many people are prescribed medications as if nothing has changed. This is where the danger begins. Not because medicine is bad, but because physiology evolves with age. Let's start with metabolism. When you were younger, your liver processed medications efficiently. Enzymes were active, circulation was strong, detoxification pathways were robust. But as we age, liver mass gradually decreases and blood flow through the liver can decline. That means drugs may stay in the bloodstream longer. When a medication lingers, its effects intensify. What was once a standard dose can become an excessive dose simply because the body clears it more slowly. Now think about the kidneys. Kidney function naturally declines with age, even in healthy individuals. After age 40, kidney filtration rate slowly drops year by year. By the time someone reaches their 70s or 80s, the kidneys may not eliminate medications as efficiently as before. Many drugs, especially blood pressure medications, diabetes medications, anti-inflammatories, and certain heart drugs, rely heavily on kidney clearance. If those medications accumulate, they don't just sit there harmlessly. They can cause electrolyte imbalances, fluid retention, blood pressure swings, and increased cardiovascular strain. In some cases, they can even trigger arrhythmias, irregular heart rhythms that increase stroke risk. Then we look at body composition. As we age, muscle mass declines and body fat percentage often increases. This changes how medications distribute throughout the body. Some drugs are fat soluble and can accumulate in fatty tissue, leading to prolonged effects. Others are water soluble and may reach higher concentrations because total body water decreases with age. This shift affects how strongly a drug acts and how long it lasts. A sedative may cause deeper, longer sedation. A blood pressure medication may drop pressure too quickly. A blood thinner may increase bleeding risk more than expected. Now let's talk about the heart itself. Aging arteries lose elasticity. They become stiffer. This stiffness increases systolic blood pressure and forces the heart to work harder. At the same time, the electrical conduction system of the heart becomes more sensitive and sometimes less stable. That means older adults are more prone to arrhythmias, especially when medications alter electrolyte balance or autonomic tone. The autonomic nervous system, which controls heart rate, blood pressure, and vascular tone, also becomes less responsive with age. When you were younger, your body could rapidly adjust to changes, stand up quickly, your blood vessels constricted instantly to prevent dizziness, become dehydrated, your heart compensated efficiently. In older adults, these adjustments are slower. If a medication lowers blood pressure or affects hydration, the body may not compensate fast enough. That can lead to fainting, falls, or reduced blood flow to the brain and heart. And here's something many people overlook: receptor sensitivity changes. Medications work by binding to receptors in the body, like keys fitting into locks. With aging, the number and sensitivity of these receptors can change. Sometimes receptors become more sensitive, meaning a small dose produces a stronger effect. Other times they become less responsive, leading doctors to increase dosage, which can increase side effects elsewhere. Now add inflammation into the picture. Aging is associated with a phenomenon called inflammaging, a low-grade chronic inflammatory state. This baseline inflammation makes blood vessels more vulnerable. When certain medications add even slight stress, whether through blood pressure changes, clotting alterations, or endothelial effects, the combination can tip the balance toward plaque instability. Think of it like this. Imagine your cardiovascular system as a bridge. When you're younger, the bridge is strong and flexible. It can handle heavy traffic. As you age, small cracks appear. The structure is still standing, but it's less resilient. Now add extra weight, medications that increase blood pressure, alter clotting, or stress the kidneys. That bridge may still look fine from the outside, but internally, the strain is greater. Another crucial factor is polypharmacy. Older adults are far more likely to take multiple medications. Each additional drug increases the complexity of how the body responds. Drug A may slow kidney function. Drug B may raise potassium. Drug C may alter heart rhythm. Individually, each effect may be mild. Together, they can create a cascade. And here's the silent part. Symptoms in older adults are often atypical. A heart attack may not present as crushing chest pain. It may show up as fatigue, shortness of breath, confusion, or mild discomfort. A stroke may begin with subtle imbalance or slight speech difficulty. Because aging changes how the body expresses distress, medication-related problems may go unrecognized until serious damage occurs. We must also consider dehydration. Older adults often have a diminished sense of thirst. Combine that with medications like diuretics or blood pressure drugs, and dehydration becomes more likely. Dehydration thickens the blood, increases heart rate, lowers blood pressure unpredictably, and increases clot risk. Again, it's not one single factor, it's the interaction. The key message here is not that aging equals fragility. Aging equals change. And change requires adjustment. Medicine should never be static. A prescription written 10 years ago should not automatically continue unchanged. Doses may need reduction. Some medications may need discontinuation. Others may need closer monitoring. This is why individualized care becomes more important with age. Lab values should be interpreted in context. Kidney function should be checked regularly. Blood pressure should be monitored not just in the clinic but at home. Heart rhythms should be evaluated if symptoms arise. Lifestyle also becomes more powerful with age. Nutrition, movement, hydration, sleep, stress management, these are not secondary, they are foundational. When lifestyle improves, medication needs often decrease, and when medication load decreases, cardiovascular risk often improves. The elderly body is not weaker, it is different. It is more sensitive to imbalance. It demands precision rather than routine dosing. It requires awareness rather than assumption. If you are over 60, understand this deeply. Your physiology deserves respect. If you are a caregiver, advocate for medication reviews, ask whether dosages are age appropriate, ask whether kidney function supports the current regimen, ask whether any drug is still necessary. Because what worked at 50 may overwhelm the system at 75, and recognizing that reality is not a sign of decline, it is a sign of wisdom. Aging changes how the body handles medication, and when we honor those changes, we protect the heart, the brain, and the years ahead. There is a silent epidemic happening in the elderly population, and most people don't even realize it. It's not a virus. It's not a new disease. It's something far more subtle and in many cases preventable. It's called polypharmacy, which simply means taking multiple medications at the same time. Now let me be very clear. Sometimes multiple medications are necessary. A person may need a blood pressure medication, a cholesterol medication, a diabetes medication, and perhaps something for thyroid or heart rhythm. Modern medicine has saved countless lives. But here's where we must pause and think critically. The more medications you add, the more complex the chemistry inside the body becomes. Each drug has its own effect, but drugs do not act in isolation. They interact, they influence one another, they change how each other are absorbed, metabolized, and eliminated. And in the elderly, where metabolism and kidney function are already altered, these interactions can quietly increase the risk of heart attack and stroke. Let's just break this down in a practical way. Imagine a 72-year-old patient taking medication for high blood pressure. That medication slightly lowers blood pressure and reduces strain on the heart. Good. Then they are prescribed a diuretic, a water pill to remove excess fluid, also reasonable, but the diuretic lowers potassium levels. Low potassium can trigger irregular heart rhythms. To manage arthritis pain, they take an NSAID, which can raise blood pressure and reduce kidney function. Now, kidney clearance slows, drug levels begin to accumulate. Suddenly, what began as reasonable individual prescriptions has become a complex web of physiological effects. Blood pressure fluctuates. Electrolytes shift. The heart becomes more irritable. The risk of arrhythmia increases. And arrhythmias are a major cause of stroke in older adults. This is not hypothetical. This happens every day. One of the biggest concerns with polypharmacy is cumulative side effects. A medication may slightly increase blood pressure, another may slightly increase clotting tendency, another may cause mild dehydration. Each effect alone might not be dangerous, but combined they create a cardiovascular environment under stress. Think of it like adding weight to a scale. 1 pound doesn't tip it, 2 pounds may not either, but 5, 6, 7 small weights and suddenly the balance shifts. Another danger lies in drug-drug interactions at the liver level. Many medications are metabolized by the same enzyme systems. If one drug blocks an enzyme, another drug may build up to higher levels than intended. In older adults where liver function may already be reduced, this effect is amplified. For example, certain heart medications combined with specific antibiotics or antifungal drugs can increase the risk of dangerous arrhythmias. Some antidepressants can interact with cardiac medications in ways that prolong the QT interval, an electrical measurement in the heart that when prolonged increases the risk of life-threatening rhythm disturbances. Then there's the issue of blood thinners. Many elderly individuals are on anticoagulants to prevent stroke, especially if they have atrial fibrillation. These medications are life-saving, but when combined with NSAIDs, certain supplements, or even other prescriptions that affect clotting, the risk of bleeding increases, and bleeding inside the brain is a catastrophic event. Polypharmacy also increases the likelihood of medication errors. Doses may be confused, timing may be inconsistent. A medication intended to be taken once daily may accidentally be taken twice. Cognitive changes in older adults can make complex medication schedules difficult to manage. One missed dose here, one extra pill there, and the cardiovascular system pays the price. Let's also talk about what's called the prescribing cascade. This is when a side effect from one medication is mistaken for a new medical condition leading to another prescription. For instance, a blood pressure medication may cause swelling in the legs. That swelling is interpreted as fluid retention, and a diuretic is added. The diuretic causes dehydration and low blood pressure, leading to dizziness. A new medication is prescribed for vertigo. Now, 3 medications are addressing what began as a side effect of one. Every additional drug increases complexity, and complexity increases risk. In the elderly, homeostatic reserve, the body's ability to maintain balance is reduced. Younger bodies can compensate quickly when something shifts. Older bodies compensate more slowly. When multiple medications push the system in different directions, the heart and brain may not adapt fast enough. Consider blood pressure regulation. One medication lowers pressure, another raises it slightly. Dehydration lowers it further. Anxiety raises heart rate. The result is instability. Blood pressure swings can reduce blood flow to the brain, increasing stroke risk, or they can strain the heart, increasing heart attack risk. Electrolytes are another critical factor. Potassium, magnesium, sodium, these minerals are tightly regulated. Many medications alter these levels. When multiple drugs shift electrolytes in different directions, arrhythmias become more likely. Atrial fibrillation, for example, dramatically increases stroke risk. And here's something deeply important. Many elderly patients see multiple specialists. A cardiologist prescribes one set of medications, an endocrinologist prescribes another, a primary care physician adds something else, a pain specialist adds another layer. Each doctor may be acting appropriately within their specialty, but unless someone is looking at the entire medication list holistically, interactions may be missed. That's why medication reconciliation is not optional. It is essential. Every older adult should have a comprehensive medication review at least once a year, ideally more often. This includes prescription drugs, over-the-counter medications, and supplements. Many supplements affect blood pressure, clotting, or heart rhythm. Just because something is natural does not mean it is harmless when combined with pharmaceuticals. The goal is not to eliminate necessary medications. The goal is optimization, simplification when possible. Dose adjustment when appropriate. Discontinuation of unnecessary drugs. Sometimes reducing one medication improves blood pressure stability. Sometimes stopping an NSAID improves kidney function and lowers cardiovascular strain. Sometimes adjusting timing prevents dangerous interactions. The human body is an intricate orchestra. Each medication is like adding an instrument. One or two instruments may enhance the music, but if too many play at once without coordination, the result is chaos. Polypharmacy increases danger, not because medicine is flawed, but because complexity demands vigilance. And in the elderly, vigilance must be proactive, not reactive. If you or a loved one are taking multiple medications, do not panic, but do not ignore it either. Ask for a full review, bring every bottle to the appointment, ask whether each medication is still necessary, ask whether dosages are age appropriate, ask whether interactions have been evaluated. Because when it comes to protecting the heart and brain in the elderly, sometimes the most powerful intervention is not adding another pill, but carefully removing one. If there is one principle that can dramatically reduce the risk of heart attack and stroke in older adults, it is this: regular medication review combined with intentional lifestyle change. Not one or the other, both. Because medication without lifestyle adjustment is incomplete care, and lifestyle without medical awareness can sometimes be insufficient. Together they create protection. Let's begin with medication review. Most people assume that once a drug is prescribed, it is meant to be taken for life. That is not always true. Medicine should be dynamic. Your body changes, your health status changes, your weight changes, your kidney function changes, your activity level changes, and your medication should be reassessed in light of those changes. Every older adult should have a structured medication review at least once a year, ideally every 6 months. This means sitting down with a qualified healthcare provider and reviewing every single pill being taken, prescription medications, over-the-counter drugs, supplements, herbal products, everything. The question is simple but powerful. Is this still necessary? You would be surprised how often medications are continued simply out of habit. A drug prescribed after a temporary condition may still be on the list years later. A higher dose prescribed during a stressful period may no longer be appropriate. Sometimes a medication was added to treat a side effect from another medication that is no longer needed. Reducing unnecessary medications decreases strain on the liver and kidneys. It reduces the risk of drug interactions. It improves blood pressure stability. It lowers the chance of electrolyte imbalances. And most importantly, it reduces cardiovascular stress. Another critical part of review is dosage adjustment. As kidney filtration declines with age, certain drugs need lower doses, blood thinners, diabetes medications, blood pressure drugs, all may require modification. The goal is not maximum suppression of numbers. The goal is balance and safety. Now let's move to lifestyle, the foundation of heart health. Food is not just calories, food is chemistry. Every bite influences inflammation, blood vessel health, blood sugar stability, and cholesterol metabolism. A diet rich in whole foods, vegetables, fruits, healthy fats, clean protein sources, nuts, seeds, and fiber directly supports endothelial function, which is the inner lining of the blood vessels. When the endothelium is healthy, arteries remain flexible. Flexible arteries maintain stable blood pressure. Stable blood pressure reduces strain on the heart. Reduced strain lowers heart attack risk. On the other hand, highly processed foods, excessive refined sugars, and inflammatory oils increase oxidative stress. Oxidative stress damages blood vessels. Damaged vessels are more prone to plaque buildup and clot formation. Nutrition alone can significantly reduce the need for certain medications. Improved diet often lowers blood pressure naturally. It improves blood sugar control. It reduces triglycerides. Sometimes with physician guidance, this allows for dose reduction or medication elimination. Movement is equally powerful. The heart is a muscle. Like any muscle, it strengthens with use. Regular physical activity improves circulation, enhances insulin sensitivity, lowers blood pressure, and reduces inflammation. Even simple daily walking can improve vascular elasticity. Exercise also improves autonomic balance, the nervous system control of heart rate and blood pressure. A balanced autonomic system reduces arrhythmia risk. And since irregular heart rhythms are a major cause of stroke in older adults, this matters deeply. You don't need extreme workouts. You need consistency, 30 minutes of brisk walking, light resistance training to preserve muscle mass, gentle stretching for circulation. Movement is medicine. Hydration is often overlooked but critically important. Dehydration thickens the blood, increases heart rate, and can destabilize blood pressure. Many older adults do not feel thirst as strongly. If you are on diuretics or blood pressure medications, hydration becomes even more important. Balanced hydration supports kidney function and helps medications work safely. Sleep is another pillar. Poor sleep increases cortisol and adrenaline. Elevated stress hormones increase blood pressure and heart rate. Chronic sleep deprivation contributes to insulin resistance and inflammation. Improving sleep hygiene, consistent bedtime, limiting screens, managing stress can reduce cardiovascular strain without adding another pill. Stress management may be one of the most underestimated factors in heart health. Chronic stress activates the sympathetic nervous system, the fight or flight response. This increases blood pressure, heart rate, and clotting tendency. Over time, this state contributes to plaque instability. Simple breathing exercises, mindfulness, prayer, time in nature, social connection, these are not luxuries. They are protective factors for the cardiovascular system. Now here's the powerful connection. When lifestyle improves, medication burden often decreases. Lower blood pressure through exercise and diet may allow a reduction in antihypertensive drugs. Better blood sugar control through nutrition may reduce diabetes medication dosage. Improved sleep may eliminate the need for sedatives. And when medication burden decreases, cardiovascular risk often decreases. This is not about rejecting modern medicine. It is about optimizing it. Medications are tools. Lifestyle is the environment in which those tools operate. If the environment improves, fewer tools are required. It is also important to monitor proactively. Check blood pressure at home, track blood sugar. If diabetic, monitor weight. Have regular lab work. Awareness allows early adjustment before problems escalate. For caregivers, advocacy is essential. Attend appointments when possible. Bring a full medication list. Ask questions. Request clarification. Ensure that one physician is overseeing the complete picture, not just individual specialties. The goal is simple: protect the heart and brain while preserving quality of life. Prevention is not passive. It is active, intentional, and ongoing. Medication review prevents unnecessary risk. Lifestyle transformation strengthens the body from within. When you combine intelligent medication management with disciplined lifestyle habits, you create a powerful shield against heart attack and stroke. You shift from reactive care to proactive protection. And perhaps most importantly, you regain a sense of control. Instead of feeling dependent solely on prescriptions, you recognize that your daily choices, what you eat, how you move, how you sleep, how you manage stress, directly influence your cardiovascular future. Your heart is not just a pump, it is the engine of your vitality. Protect it with wisdom. Review what you take, strengthen how you live, and give your body the environment it needs to thrive safely in the years ahead.